Dr. Scott Fogel, ND, is a board-certified naturopathic doctor. He graduated with academic honors from the National College of Naturopathic Medicine in Portland, Oregon. His thesis, listen to this, Mercury Toxicity and Assessment, won the Dean of Naturopathic Medicine Thesis Award. Dr. Fogel has lectured on many aspects of medicine, ranging from mercury toxicity, sleeping disorders, ocular pathologies, hypertension, thyroid, and phase 1 and phase 2 detoxification. Dr. Fogel now resides in Fort Lauderdale, Florida, and is the Director of Clinical Information at Life Extension, where he oversees the quality and consistency of the scientific and medical information presented by Life Extension. Please join me in welcoming Dr. Scott Fogel, who will be giving us the most important updates on vitamin D.
All right, let me start off with my disclaimer before I forget this. I guess, have a financial interest in my company. Life Extension sells vitamin D, but I will also comment that just about everybody else out there sells vitamin D as well, too. And also, it's a pleasure for me to be with all of you, because when I was writing my thesis on mercury toxicity and assessment, part of the reason I was writing it because at that time, every time I talked to a different doctor, I got a different opinion on what's the right way to do it, what's the best way to do it. And I got so frustrated, I decided, well, this is what my thesis is going to be on. Little did I know at the time what I was getting into. But that's how I came across your fabulous organization. So vitamin D, it's been in the news a lot, and Dr. Getoff actually talked a little bit about it, and I'm going to go into a little bit more detail on it. First thing, is it really a vitamin? It's technically not even a vitamin. Vitamin D is a vitamin that's really in a class all by itself. Its primary metabolic product, calcitriol, is actually a type of hormone that targets over 200 genes in the human body. It is the only vitamin that is conditionally essential. And what that means is, if you're out in the sun, as Dr. Getoff was saying, and you get vitamin D, your body's made it. You don't need to have it come into your diet. If, however, you're not in the sun, or if you're using a lot of sunscreen, as we'll talk about later, then you have to get it in your diet. That's what makes vitamin D conditionally essential. And it has many mechanisms of action with genes as its targets. Now, there are several forms of vitamin D that have been discovered. There's vitamin D1, 2, 3, 4, 5. But the two major forms are vitamin D2 and D3, and we collectively call them calciferol. We're going to talk more about those in detail. Chemically, the various forms of vitamin D are a type of steroid in which one of the bonds in the steroid rings is broken. So vitamin D is actually a group of fat-soluble prohormones, and the two major forms are vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Now, the term vitamin D also refers to metabolites and other analogs of those substances. And there are over 40 vitamin D metabolites. So let's talk a little bit about D2. Vitamin D2 is not produced by the human body. It's derived from fungal sources or yeast sources, or even a little bit from plant sources. Vitamin D2, though, allows companies that put out vitamin products to create vegetarian formulas because it's derived from fungal or yeast sources. Vitamin D3 is derived from animal sources or made in the skin. It's made from 7-dehydrocholesterol reacting with UVB ultraviolet light. So down here, this is your visible spectrum, the rainbow colors that we're all used to seeing. Then here, over here is your UVB spectrum. And that's where you're getting your vitamin D made. So food sources. This is important. There are very few dietary sources of vitamin D. So, clinical pearl, strict vegetarians, and lactose intolerant individuals are likely to be substantially vitamin D deficient. And so are those in northern areas. We have anybody from Canada? Okay, that's pretty northern. Dark-skinned, smokers, and alcoholics. Food. Cod liver oil, one of the best suppliers of vitamin D, but also you have to be careful because oftentimes you get the vitamin A in it. So you have to make sure you monitor the vitamin A intake if you're going that route. Salmon. Of course, we all here know you want to do the wild-caught salmon for the decrease in mercury. Mackerel, tuna. Well, yeah, you can get some vitamin D in tuna, but how much mercury may you be getting in there? And then we get into the fortified sources, the milk and other sources there. But again, not really getting that much in diet. So in supplements, the D2, as we mentioned, it comes from irradiation of the ergosterol from yeast. D3, through the ultra-irradiation of 7-dehydrocholesterol from lanolin. And this is actually interesting. Lanolin, it's the yellow substance secreted by the sebaceous glands of wool-bearing animals. And in most cases, it's sheep. So if you're taking a vitamin D3 product, most of the time, it's going to be derived from lanolin. So we mentioned cod liver oil, but be careful of vitamin A. And so if you're buying vitamin D2 or having patients take it, if it's D2, now you know it comes from a plant source. If it's D3, generally it's going to be from lanolin, from sheep. And of course, there's also prescription form as well. Here's a picture of my 2 cats that I have at home. I take pictures of them in various positions as well. This lion right here, the male lion, he's basically saying, hey baby, you know, I just want to thank you for being such a good lioness. That zebra you brought me last night was delicious. Really enjoyed that. Some people see this, well, maybe this is a sign of affection, maybe this is grooming. But very few people know that lion is actually licking vitamin D off the other lion. That's how many mammals, covered in fur, get their vitamin D from grooming each other. Because think about it. Look at all that fur. How much sunlight is actually getting to their skin? Pretty much none. So just like the sheep, the oil is secreted onto the fur. The oil on the fur then gets exposed to the sunlight, the UVB radiation, and starts the stage of the conversion to vitamin D. And so by licking each other, they're actually getting vitamin D. You didn't know there was going to be a little Discovery Animal Planet action in here, did you? Some more clinical pearls. Dr. Getoff mentioned about the shadow. Here's another one. The UV index. If you're on a website and you're checking the weather because you want to figure out if you can go outside, what to wear, you can look. Most of the websites nowadays will publish a UV index. If the UV index is greater than 3, you can make vitamin D. If it's not, you're not going to make any vitamin D. Here's another very important one. Sunscreen. We all slather it on nowadays. We're all programmed to do that. If you use a sunscreen of SPF 8 or greater, you've pretty much blocked your conversion of vitamin D. At SPF 8, it decreases vitamin D conversion by about 92%. Above that, it's pretty much 100%. Very, very important point. And also, if you're driving the car and you think, oh, I'm getting some vitamin D from the sun coming in, well, no, because the UVBs aren't going to be penetrating through glass or plastic. So it has to be direct sun. So overview. Here's the overview of creating active vitamin D. Vitamin D is produced in the skin, or you consumed it in the diet. It's going to go to the liver for its first conversion. Then it goes to the kidney for its second conversion. Now you have the active form, which is the 1,25 dihydroxy vitamin D form. This is the active form of vitamin D. So it starts in the skin or the diet, goes to the liver, goes to the kidney. And this form, this metabolically active form, is known as calcitriol. Now note here too, as this is written, there's no subscript here. If there's no subscript put, that means that this can be either from vitamin D2 or from vitamin D3. This is an important point we'll talk about more when we talk about labs. So again, skin or diet, liver, kidney, now we have the active 125 form in the bloodstream. Here's your steroid ring. You get the ultraviolet light, and what's happening is this bond right here, it breaks it. Once that happens, goes to the liver adds a hydroxyl group here at the 1 position. Goes to the kidney, this other hydroxyl group gets added here at the 25 position. So that's how we end up making 125, the active form of vitamin D. Anybody know what vitamin this is? It's a B vitamin. Causes flushing. All right, now everybody's on board. Niacin. So this is a vitamin. This is vitamin D. Look up here. Here's cortisol. Here's progesterone. Here's estradiol. Here's testosterone. Does this vitamin look like any of these? No. Does vitamin D look very similar to these? Absolutely. This is a critical point to understanding all the research that is now coming out about vitamin D, because it's not really a vitamin. It's much more like a hormone. And I think this picture, I like this picture to me because you see in your mind and go, well, yeah, that just makes sense. So poor vitamin D has an identity crisis. The body turns vitamin D into 2 very important hormones, calcidiol and calcitriol. These 2 hormones are also called vitamin D. Dr. Cannell from the Vitamin D Council, which Dr. Getup mentioned, which I would encourage everybody to visit. It's a wonderful website. He says this borders on ridiculous, and I would agree. This is like saying, here's all the hormones, estrogen, progesterone, pregnenolone, testosterone, estriol, and we're going to call them all testosterone. It doesn't make any sense. When you say vitamin D, if somebody talks to me about vitamin D and says a study was done on vitamin D, that doesn't mean anything to me. Because in my mind, I'm thinking, well, there's about 40 different things that could really be what was studied. So poor vitamin D has a little bit of an identity crisis. So remember when you're looking at studies, you want to try to find out specifically which form they mean when they say vitamin D, because it could mean one of any 40 different forms. So the first stop in the liver, in the blood, vitamin D is bound to a D-binding protein. It gets carried to the liver, and then one of the cytochrome P450 enzymes acts on it. Once converted to calcidiol, there appears to be no difference in the biological activity from D2 or D3. Now, here's a clinical pearl. Most assays for 25-hydroxy-D cannot differentiate the 2 distinct forms, D2 or D3. So what they do on their lab work, they'll put it this way. 25OHD, no subscript. If there's no subscript there, that means that they're testing for both, the total of D2 and D3 combined. That's important because if you had a patient who was, say, taken because they're a vegetarian, the D2 form, and your lab only checks the D3 form, you're going to get back a very low reading, and you might miss it because it's not checking the D2 form. So from LabCorp, which is the company that I work for, that's who we predominantly work with, they report it this way. So I know that that report, it's a total of D2 combined with D3. Anybody have a laser pointer that's working? Perfect. Thank you. Oh, look at that. I got so many now. Perfect. So which form is better, D2 or D3? Well, like many things in medicine, it really depends who you ask. Based on the chemistry, it could be argued it does not matter because the liver hydroxylate them in an essentially unregulated manner to make the calcidiol. But we'll talk more about this later if we have time. So next up, here's the kidney. I just thought this was funny. It says, the kidney, float like a butterfly, sting when you pee. So calcidiol, which was made in the liver, is then converted in the kidney by another cytochrome P450. And it converts it into the calcitriol, which is thought to have most of the actions throughout the body. Now here is what most people do not know about vitamin D. There are multiple autocrine functions of vitamin D. And this occurs because of the conversion of calcidiol, which was the liver made, to calcitriol in the tissues. This is big news, and this is what really gives vitamin D its multiple wide-reaching effects throughout the body, and why you'll see there's so many studies on a wide variety of conditions. Because we used to think, okay, liver works on it, goes to the kidney, kidney makes it into the active form. That's true, but now we know the liver works on it, makes the calcidiol, but the calcidiol can go into the tissues, and then the tissues can actually make the calcitriol for themselves. That's a very, very big new information for vitamin D. And so here it is again. Vitamin D, the liver, through this cytochrome P450, makes the calcidiol. Here's another cytochrome P450, makes the calcitriol, which we used to thought just happened in the kidney. But now, because so many other tissues we're finding out can do this on their own, it now has effects from vibratory respiratory disease, cancer, osteoporosis, heart disease, multiple sclerosis, diabetes, hypertension, and the list is growing every day. Now, can I get too much vitamin D from being in the sun? No. It's kind of a self-limiting exposure with vitamin D. The maximum endogenous production with full body exposure to sunlight is about 10 to 20,000 IUs a day. Beyond that, any excess vitamin D3 is destroyed actually by the sunlight. So the most that you can make, depending on the studies that you look at, is about 10 to 20,000 IUs a day. So why do we even care? What does vitamin D really do? And is it really that sexy and exciting? I was going to put a picture of like a woman silhouette for the men, and then for the women to signify sexy and exciting, I thought maybe like a picture of a Louis Vuitton purse or something like that. So this is from the Vitamin D Council's website. I have no connection with them except that I like a lot of the information that they put out there. Current research has implicated vitamin D deficiency as a major factor in the pathology of at least 17 varieties of cancer now, heart disease, stroke, hypertension, autoimmune disease, diabetes, depression, chronic pain, osteoarthritis, osteoporosis, muscle weakness, muscle wasting, birth defects, periodontal disease, and there's even more. Almost sounds too good to be true. In 2007, there was a landmark article in the New England Journal of Medicine on vitamin D. And they highlighted what I just talked with you about, is that the discovery that most tissues and cells in the body have a vitamin D receptor. That's big news. Most tissues in your body have a vitamin D receptor. But the really big news here is several possess the enzymatic machinery to convert that calcidiol that the liver made to the active 125 vitamin D form. That's provided so many new insights into the function of this vitamin that really should be called a hormone. And even in the article in the New England Journal of Medicine, they're talking, hey, chronic diseases, cancer, autoimmune disease, infectious disease, cardiovascular disease. It's a very important article. If you want more about vitamin D, it's definitely one of the articles that you should read. Deficiency and its implications. Vitamin D deficiency and its consequences are extremely subtle, but have enormous implications for human health and disease. It is the reason that vitamin D deficiency continues to go unrecognized by a majority of healthcare professionals. Fortunately, that's starting to change, and I hope for everybody in this room, after this talk, you will all have your vitamin D levels checked, as well as every patient pretty much that you come in contact with. The VDR. The VDR is the vitamin D receptor. It's a member of the steroid hormone receptor family of nuclear receptors. And it actually comes in, once it's activated by vitamin D, it comes in and binds to hormone-responsive elements on your DNA. This isn't a vitamin, folks. This is affecting your DNA. And because of that, it induces the expression of specific gene products. Vitamin D receptors are expressed by cells in most organs: brain, heart, skin, gonads, prostate, breast. The vitamin D receptor is thought to be involved in cell proliferation and differentiation. Immune system. We'll talk more about that as well. So here it is again. We saw this top part earlier. And maybe I need to take a course in laser pointing. Maybe they just don't like me. Oh, is it working? Oh, that one is working.
Commercially, it's a 0 point.
This one has taken its vitamin D for today. So here, once the vitamin D, this is the active form in the blood, comes through, notice it goes through the cell membrane. This is the nucleus of the cell, goes through that, because remember, it's a hormone, fat soluble, gets right in there, activates the VDR. The VDR comes down to your DNA and causes gene transcription. A very important point. It affects things on a genetic level. That is why vitamin D is so important. By causing this gene transcription, we're affecting protein formation. Enzymes. You could do a whole talk on enzymes and how enzymes are beneficial for health. Vitamin D helps with protein formation. Enzymes, structural proteins. How about collagen? One of the major building blocks of connective tissue in the whole body, bones, skin. How many people want to stay young looking? Okay, we've got a few people. Some other people are like, I don't care anymore. So think of vitamin D as a steroid hormone. Think of it just like you would think of testosterone or progesterone. Here's another clinical pearl. People on glucocorticoids are known to decrease the expression of the vitamin D receptor, which is expressed in most tissues of the body. Health-promoting effects. I don't have time to go into this, but I can tell you for each one of these, you could do an hour lecture easily. Normalizing blood pressure, anti-inflammatory effects, anti-diabetic effects, chemoprevention, cancer, osteoporosis, prevention of stress fractures, multiple sclerosis, immune enhancement. My slides are all available. You can download those, and you can look up any of these. I listed here the source. That's the company I work for. We kind of pulled a lot of that information together. So as an example, let's just talk about some of the cardiovascular benefits. The farther north you live, the more likely you will suffer a heart attack, unless you happen to be an Eskimo. And what do Eskimos eat? Yeah, they're getting a good amount of vitamin D. How interesting is that? You keep going up, more and more heart attacks, till you get to a group of people who are actually consuming vitamin D in their diet, heart attack risk goes down. Cardiovascular, cardioprotective benefits. Vitamin D deficiency has been shown to diminish contractile function of heart muscle cells, contribute to endothelial dysfunction, that's huge, distort heart muscle structure, increase smooth muscle growth in the coronary artery wall, which you don't want because you don't want to have plaque building up there. Abnormal kidney function. We saw that the kidney also helps to make that active form. So if people have abnormal kidney function, is their active form of vitamin D going to be impacted? Yeah. So they found that, hey, those people have higher risk for cardiovascular problems, and if we actually give people, like say on dialysis, who have severe kidney problems, it actually benefits them from a cardiovascular perspective. Cancer, brain cancer, breast cancer cells. Also in the New England Journal in 2007, directly or indirectly, calcitriol controls more than 200 genes, including genes responsible for the regulation of cellular proliferation, differentiation, apoptosis, and angiogenesis. You guys are all smart. You know that all of those things are very important for cancer. In fact, you can create a drug just from affecting one of these things. Vitamin D can affect all of them. Why do you think it's been now discovered to be so beneficial and being looked at more and more for cancer prevention? Because it controls so many different genes that affect so many of those different aspects that are important for cancer. New England Journal of Medicine talked about that again. And again, it's because some of these tissues, brain, prostate, breast, colon, have the enzyme we now know to convert to the active form in those tissues themselves. They have that enzyme. Somebody was calling, they were so happy to hear that. So again, here's the flow. So let's look at some studies. This was a very important study in 2007 in the American Journal of Clinical Nutrition. This was a 4-year study, so pretty good time frame, population-based, double-blind, randomized, placebo-controlled. Conclusion, improving calcium and vitamin D nutritional status substantially reduces all cancer risk in postmenopausal women. That's a big study. That's big news. This one just talks a little bit about more. Now notice the study here, they used at least 1,000 IUs of vitamin D. And there's just some more details of the study. Another study, PSA. The median PSA doubling time increased from 14 to 25 months after commencing the active form of D3, this vitamin D3. And again, notice the dose, 2,000 IUs. This was no 400 IUs. This is to really get a good study that's going to show you positive results. It's going to have to be at least 1,000 to 2,000 to actually give you achievable results. So prostate health. Here's another one for prostate health. The therapeutic indication is that vitamin D supplementation in the range of 2,000 IUs a day, a dose comparable to the effects of summer, can benefit men monitoring for rising PSA. So men, if you're interested in keeping your prostate, please get your vitamin D levels checked. Here's a study that showed no effect. Headlines, calcium plus vitamin D supplementation and risk of breast cancer. No effect. Don't take it, don't bother. Folks, I'm going to tell you this right now. If you look at a study and it says no effect with vitamin D first thing, go to that study and look at the dose. If you look at the dose on this study, what's it say? 400 IUs. You're not going to get a positive effect study at a dose of 400 IUs. We know by far now on the research, you really got to get to that 1,000 to 2,000 level. So anytime you see a no effect study, check the dose on vitamin D. Influenza. There's a whole idea here about maybe there's a connection between the outbreaks of influenza and having low levels of vitamin D. It's more information, therefore, if you can read about that as well, too, in the slides. Time Magazine, inflammation. Everybody here is familiar with inflammation and how that contributes to chronic disease. Immunomodulatory and anti-inflammatory effects of vitamin D. NF-kappa beta. Vitamin D affects this one. It's very important. This alone, just this information alone, it would be significant enough for everybody to check your vitamin D. Because NF-kappa beta is a protein, it acts as a switch to turn inflammation on and off in the body. It's like an orchestrator of inflammation. Most people are familiar with some of the cytokines. We have the inflammatory cytokines, interleukin-6, IAOMT, tumor necrosis factor. NF-kappa beta is one of the switches that helps orchestrate a lot of those inflammatory cytokines. So if vitamin D can modulate one of the orchestrators of those inflammatory cytokines, that's incredible. So consistent with its role, incorrect regulation of NF-kappa beta has been linked to cancer, inflammatory and autoimmune diseases, septic shock, viral infection, and improper immune development. And vitamin D can help regulate that. No wonder vitamin D has so far many reaching effects. And this is a study that showed that it does indeed decrease the NF-kappa beta. You guys might not be familiar with this term. I'll try to go slow for everybody here. Good, a few people laughed. That was a joke. And I do want to say that the two presentations I heard yesterday morning on periodontitis were just incredible. And I hope that both of those presenters are here because I think one thing they could even add into the program is checking the vitamin D, because vitamin D may reduce the susceptibility to gingival inflammation through its anti-inflammatory effects. And there's more studies on it. Low serum vitamin D concentrations may be associated with the periodontitis disease independently of bone mineral density. Periodontal disease and cancer. In the Journal of American Medical Association in 2008, people with periodontal disease have higher cancer risk. 2 articles in The Lancet, periodontal disease and cancer. It's all kind of coming together, how vitamin D can be connected to periodontal disease. We saw how vitamin D can regulate multiple factors in cancer development. And then this is interesting. They looked at men with chronic periodontitis, and one of the things they discovered is a polymorphism. And Dr. Woods talked about some polymorphisms that people can have that make them more susceptible to mercury. So same thing here. If you have a polymorphism of your vitamin D receptor, that's going to make you more significantly impacted with periodontitis. Now, I know you guys probably won't be interested in this one, but here's a study that showed calcium and vitamin D supplements reduce tooth loss in the elderly. Chronic pain. I would have never thought that vitamin D could affect chronic pain, but there's actually some good studies on chronic pain. Improvement of chronic pain, failed or failed back surgery with vitamin D replacement. And what they concluded is vitamin D insufficiency is common. We know that now. But replacing it to normal levels can help people who have chronic low back pain or have failed back surgery may want to improve the quality of their life, or they found, and even in some cases, resulted in complete resolution of the symptoms. Wow, vitamin D can help in chronic pain. There's more studies than this. I'm just giving you guys a highlight on that. How about dementia? Anybody here looking forward to dementia? Can't remember. Sometimes you think, well, maybe it would be good. You don't remember, all that stuff. So much less responsibility. So we found that the studies now are linking cognitive function with vitamin D. In the interest of time, I'm just moving along at a pretty good clip. So vitamin D is a neurosteroid hormone. We now understand that the active form of vitamin D, the calcitriol, plays an equally important role as a neurosteroid hormone, and one that is directly responsible for many elements in brain development and behavior. Vitamin D and autism. Really take a look at this, because I know that many of you are working with children with autism. So because of its potent effects, in 2001, the researchers labeled it the neglected neurosteroid and concluded that vitamin D deficiency should be examined in more detail as a candidate risk factor for neurodevelopmental disorders such as autism. And when you start to look, there's some very interesting information out there. So the active form of vitamin D has properties that help protect the brain tissue by reducing those inflammatory cytokines. Calcitriol also protects brain tissue by stimulating production of neurotrophins. These help to combat toxicity in the brain. Glutathione. Who doesn't love glutathione? Wonderful tripeptide. Calcitriol also increases brain levels of glutathione. Wow, how about that? Vitamin D can help get glutathione levels increased in an area we really need it, in the brain. Vitamin D, it's involved in the glutathione cycle and in cysteine transport. Vitamin D, the active form, could be an effector in controlling detoxification processes in the brain. Vitamin D, very powerful. Who would have thought it could do all this just in the brain? Prenatal low levels of vitamin D cause a dramatic dysregulation of several biological pathways, including oxidative phosphorylation. Got to make your ATP. ATP is important for energy, healing, repairing. Redox balance, cytoskeletal maintenance, calcium homeostasis, many other factors. A rat study, but still very important. Developmental vitamin D deficiency caused a dysregulation of 36 brain proteins involved in several biological pathways, most of which we just mentioned. So I presented a lot of science, and clinical studies show if the science doesn't work, you show pictures of dogs or babies. So here's a baby. The baby saying, I hope that I'm worth some vitamin D. And it's very easy to give a baby vitamin D. You can give vitamin D in a liquid emulsion, put it on your finger, put it in the baby's mouth, put it in the pacifier, done. Those studies on development, I was blown away when I saw those. And we're going to see more research on those areas in the future coming because of vitamin D's far-reaching effects and profound effects on the brain tissue. So dosage, how much? Is it dangerous? Well, we used to think, everybody watch out, vitamin D, it's fat soluble, so we have to be careful with it. Well, it's time to evolve that. In the 60s, we thought, hey, if you don't have vitamin D, it's no big deal, you just might get some osteomalacia. You give 200 IUs, that's good enough. But more recent information, remember we talked about sunlight. If you go out in the sun and your body is designed to make 10 to 20,000 IUs, does 200 seem enough then? No, it doesn't kind of really make sense. So there is no really RDA for vitamin D. There's an AI, the adequate intake, and there's the levels there, 200, 400, 600. But people now are talking about much higher levels. Here's a study, utilized 3,000 to 5,000 IUs per day to maintain a steady state in the blood. We mentioned a lot of variables that can impact vitamin D absorption, from sunscreen to dark skin to vegetarianism. Here's a picture of Sunny and Cher. Okay, you guys are still awake. So here we have Dr. Oz and Oprah. And, you know, this is very recently, the beginning of this year, January 2009. Dr. Oz was quoted on CNN talking about Oprah. She had a vitamin D deficiency. Why would that be shocking for a darker skinned person who spends a lot of time in Chicago? They're going to be vitamin D deficient. If you're watching the show right now and you live in a northern state, you're probably vitamin D deficient. I would agree. And then what does that cause? It causes autoimmune problems. So for her, it takes your thyroid, which is like your thermostat, and then it leads to weight gain. That's what Dr. Oz just said very recently. Smoking. Smoking will definitely impact your vitamin D status. So if you have an alcoholic, vegetarian smoker who lives in Minnesota, folks, you have a problem. Their time is short. They might as well start kissing other people. A few people got that. That was the one lecturer talked about kissing. Does smoking contribute to this? Of course, we all know the answer there. So I tried to, here's all the technical aspects of it. And you can see these on the slides. But really, smokers, alcoholics, vegetarians, lactose intolerant, gum disease, obese, elderly, pregnant, lactating, and using a sunscreen above 8. All those things are big factors for decreased levels. Elderly men and women, Hispanics and black, adolescents, pregnant and lactating women especially. Did a random selection of 100 people who ordered vitamin D tests through the company I work for. We use LabCorp. And I just plotted them out. Look at the variety. And most of the people who did the test were taking vitamin D, and the average was only 30. But look at the variety. I'll tell you, when you start testing and looking at vitamin D levels, you see quite a different pattern. It's really difficult to tell. So really, the best way to negate all the variables is to do the test. Get the vitamin D test done. Okay, very important. Target ranges. A conservative target range, and again, this will all be in the slides. You can download it so you don't have to take notes if you don't want to. 32 to 50 nanograms per milliliter. Pay careful attention. Some labs report it in nanomoles per liter. I'm giving you the ranges in nanograms per milliliter. So that's if you're a more conservative mindset. You're like, hey, this vitamin D, it sounds good. I'm going to start slow. A more aggressive optimal range is 50 to 80 or even up to 100. In a recent review, Dr. Canal, who does the vitamin D research, and Dr. Hollis, who is one of the major researchers in vitamin D, suggested 40 to 70. The level of a young adult in summer months is 50 to 60. So you're going to see different ranges out there as far as what the optimal is. My company originally, when we started looking at the literature, we decided on 30 to 50. As more literature came out, we just recently bumped up our recommendation to our members to 50 to 65. That's our new level that we say, hey, we think this is the best level. That's LabCorp's reference range. So 50 may be that magic number. As Dr. Getoff mentioned, 50 may be the number where you can actually start to build it up, and it may actually get into the tissues where you want it more. And here's a conversion factor, is if you have a lab that reports in nanomoles per liter. Clinical Pearl, whatever you do, don't be tempted to order the active 125 form because it's not very helpful. If somebody has vitamin D deficiency, it's still going to be normal. If they're toxic, it's still going to be normal because the body very tightly controls the active form in the bloodstream, much like it does for calcium. You know, you can be pulling calcium from the bone just to control that blood level. So don't ever order the 125 form. You always want to get the 25 hydroxy vitamin D. That's always the test that you want to do. Dr. Gedoff mentioned this. I'll just comment briefly. Quest did just recently acknowledge that they had a problem in their vitamin D testing, which is kind of funny because technically Quest had LC, liquid chromatography, mass spec testing for vitamin D, which is extremely accurate. The problem is that while it's an extremely accurate test, it's a test that is very technician dependent. Calibration has to be perfect. You have to take your time with it. And they were flooded with so many, kind of seems like, well, maybe that all didn't happen. So while it's a very accurate test, if you're moving fast or you don't calibrate your machineries appropriately, you can get inaccurate results. So that's what some of the speculation was regarding that. But Quest has sworn that they've fixed it. So dosage. What's the best dosage? Titrate it up to meet the optimal levels in the blood. That's the best way to do it. Dr. Davis wrote a nice book on, he's the author of Track Your Plaque. He likes all his patients to get up to that 50 nanograms per milliliter level. That's the target that he uses with his patients. Most people, he says, require 2,000 to 4,000 IUs per day in the winter, half that dose in the summer. Some people require 8,000, some people 1,000. So you really, really want to check in on the blood levels. That's the best way to target and titrate up your dosage. Here's the vitamin D councils. This is on their website. I just pulled it from here. It's another way. Take 5,000 IUs per day for 3 months, and then check your 25-hydroxy-D test. And this is just for reference. This is dosing for children, dosing for people of different weight, because we do know that the higher your weight, your BMI, the greater amount of vitamin D you're generally going to need. Pregnant women, check the levels every 3 months. And this is just some information about how the blood level goes up based on the dosage. And again, they found out body mass index accounted for more than 90% of the dose response variance. So the BMI is a big factor for why dosage may be different. Tanning, it's an option, especially if somebody is having digestive issues and not absorbing fat maldigestion. Tanning is a good option. So cautions, updated dosages. I think the information in the New England Journal of Medicine could really help quell some of the cautions people might feel with vitamin D. Vitamin D intoxication is extremely rare. These are quotes. I'm literally quoting from that article. Doses of more than 50,000 IUs per day raise levels of vitamin D to more than 150 nanograms per milliliter and are associated with hypercalcemia. So if you're doing 50,000 IUs a day, all right, maybe there's a chance you could run into problems. Dosages of 10,000 per day for 5 months, however, do not cause toxicity. We know that clearly from the studies now. And again, if you're checking in with the vitamin D levels, that's really how you stay out of trouble, because most of the problems caused with vitamin D are just from too much calcium getting in the blood. And most all the cases that were tied to vitamin D for hypercalcemia and from faulty industrial production, labeling errors, or dosing errors. It wasn't just because people were taking 10,000 IUs a day. There's no study out there that shows that. This is what we put on our bottles just to protect us from legally. We've looked at all the research, and that's what we came up with And basically, we're saying here, just what the New England Journal of Medicine, toxicity is very unlikely in people at dosages of 10,000 IUs or less. And in fact, some people may even need that dosage to get their levels up. People with kidney disease and other issues or certain medications may also want to be cautious as well too. Which form is better? Very controversial. The literature is confusing. Here we have one study. Vitamin D2 is much less effective than D3 in humans. Okay, great, I got it. Sounds good. Go D3. Well, 2008 study came out and says vitamin D2 is as effective as D3 in maintaining circulating concentrations. So it's hard to say. You're going to hear people talk about it both ways for that. I asked God, I said, hey, which form is better? I'm still waiting to hear back from him on that one. But meanwhile, at lower dosages, 5,000 IUs, I think based on the research, it makes more sense if you're doing that high of a dose to do the D3. My personal preference, though, is not to use the high dosages because, hey, if your body can only make 10 to 20,000 a day in sunlight, why don't we stick to that dose or below? It just makes logical sense to me. So generally, I would suggest vitamin D3 for everyone except vegetarians because it's coming from sheep, so vegetarians might not generally like that. So then in those cases, use D2, but don't really worry. If you're doing dosages below 10,000 IUs, I don't really think it's going to matter. They're still going to get the vitamin D. And as on a final note, the role of the D3 in toxic metal absorption, this was actually from the school that I went through, the National College of Naturopathic Medicine in Portland, Oregon. Not so well known, however, is that vitamin D stimulates the co-absorption of other essential minerals. But here's the kicker. You have to make sure because it can also increase the absorption of lead, cadmium, aluminum, strontium. You don't want to increase those, so you really have to make sure that the cause has been removed. You don't want people still consuming those things, or if you're giving them vitamin D, they're going to get a little bit more of that. So there's the summary. It's simple. Everybody get tested. Really, you probably want to hit at least 32 to 50, but probably higher, somewhere around that magic number of 50. When you see the gingivitis, when you see the periodontal disease, any mouth disease, especially get those people to get their levels tested. SPF sunscreen of 8 or greater, it's not going to convert. And never assume. Get the levels tested. And remember, too, that there are genetic variations, some polymorphisms out there that can affect some people with vitamin D more so than others, just like it can for mercury. And that's it. And then there's some references that if you want to learn more, there's a great